Why 95% of cancer patients should question chemotherapy. Hello, I am Dr. K. Paul Stoller, and most people diagnosed with cancer are immediately pushed toward chemotherapy. It's a big business, and there is no profit in the cure. But what if I told you that for the vast majority of cancers, 95%, chemotherapy is not curative? It is, at best, palliative. And on average, across all cancers, chemotherapy has only extended life expectancy by 3.9 months over the last 30 years, while dramatically reducing quality of life. Today, I'm going to share some uncomfortable truths about conventional cancer treatment and why exploring alternatives is not only reasonable, but often necessary. Only about 5% of all cancers are truly responsive to chemotherapy in a curative way. These include testicular cancer, Hodgkin's lymphoma, acute lymphatic leukemia, ALL, and a very short list of other specific cancers. For the remaining 95% of cancer cases, chemotherapy is not curing the disease. Chemotherapy is palliative at best. It may buy a little more time, sometimes 1 or 2 months, but at an enormous cost to the patient's quality of life. Chemotherapy is extremely toxic. Here's what it commonly does to the body: severe nausea and vomiting, complete hair loss, anemia and extreme fatigue, bruising and bleeding, cognitive changes, chemo brain, peripheral neuropathy, nerve damage, edema, swelling, sexual and reproductive dysfunction, skin and nail damage, and most dangerously, it knocks out the bone marrow, leaving patients severely immune compromised and vulnerable to life-threatening infections. It destroys the T cells, the very cells required to fight cancer. Many patients say the treatment feels worse than the disease itself. Despite decades of research, billions of dollars spent, and major advancements in chemotherapy, immunotherapy, and surgery, the average extension in life expectancy for cancer patients over the past 30 years is only 3.9 months. That is a devastating return on investment for patients and their families. This is exactly why I created a webinar on alternative and integrative cancer treatments. At KENNETHSTOLLERMD.com, I share approaches that focus on supporting the body's own healing systems, addressing root causes including chronic infections, toxins, and immune dysfunction, using evidence-based natural and repurposed therapies that many conventional oncologists still ignore. These strategies are not about abandoning all conventional care. They are about expanding your options and protecting quality of life. If you or a loved one has been diagnosed with cancer, please know this: you have more options than you're being told. Do not let fear push you into treatments without fully understanding the real odds and the real costs. Get informed, ask hard questions, explore integrative approaches. I invite you to join my webinar at KennethStollerMD.com, where I go much deeper into practical, alternative strategies that many patients are successfully using. Drop a comment below. Have you or someone you love been affected by these statistics? Share this video with anyone facing cancer. Subscribe and hit the bell for more honest, life-saving health information. You deserve to make empowered decisions, not just follow the standard protocol.